In this video, I am going to illustrate the timeline for someone to train to become a physician, and this will illustrate the amount of time and a different step someone has to go through in order to become a practicing licensed physician in the United States. But before I do that, I need to use a very specific example to illustrate this. So that example pertains to this particular individual. They are a traditional student in terms of age, meaning we'll start off with somebody who finished high school, about 18 years old, somebody who's going to pursue a Bachelor of Science undergraduate degree, someone who would want to get into a School of Medicine as opposed to someone who would want to or prefer and choose to get into a School of Osteopathic Medicine. The third one is that this person will be pursuing a specialty of internal medicine and a subspecialty of hematology oncology. All right, now that I've got that out of the way, let's proceed. I'm going to draw a straight line here to illustrate this timeline. And we said that this person is a traditional student. So this is actually end of high school over here. That's the start of our timeline, okay? And this person already wants to become a physician, and therefore we are going to look at the undergraduate degree over here. I'm going to extend this because I am actually going to put something here as well. So let's put number of years here and age in here. Okay, so how many years for a bachelor's degree? It's going to be 4 years. So year 1, year 2, year 3, year 4. In terms of age, and we said this person is a traditional student, they are going to be 18. And should be around 21 years of age by the time they're finished their bachelor's degree. So this person is going to pursue a Bachelor of Science usually in biology, which is considered a pre-medicine program. A pre-medicine program is a bachelor's degree that you could also use as a prerequisite baccalaureate degree to enter veterinary medicine. Okay, so obviously you would want to have a really good GPA. So let's put in here GPA. Let's put that hour sign, which signifies a really good GPA. So once you're done with your bachelor's, there are two things you need to do. First is you have to identify a medical school that you want to get into. So we already said that this person wants to go to a School of Medicine as opposed to choosing to go to a School of Osteopathic Medicine. That person is, during his 4th year, needs to prepare for an exam. And as a matter of fact, maybe while in his senior year or right after graduation, they need to take the MCAT, the Medical College Admission Test. Okay? At the same time, you're also applying or scouting out schools of medicine you want to get into. Now, the point here is to have a really good score in your MCAT because medical schools look at this too primarily. So you will be applying either online, sending them letters, and once you hear back from them, during the application process, you will also have to give documentation for this too. If you hear from them, they might call you for an interview, and that is what going to determine your admission. So I would imagine at this time there's going to be a lot of online interviews for this. Okay, so you're done with your bachelor's. You've identified your school. You have a good GPA. You have a good MCAT. And let's say you got admitted to your first choice of medical school, and it is a medical school, a school of medicine. Okay, so let's put a line here and divide this into the number of years you will be in medical school. And again, that will be technically 4 years. So number of years, we'll put 5, 6, 7, and 8 in here. In terms of age, by this time, they will be 22 when they start. And about 25 when they graduate. So that person is now in medical school. What happens in medical school? So the first year and the second year are pretty much, the training is a lot of classroom training. You're building up theoretical knowledge for the first and second year. This is very tough. This is like taking a major exam maybe 3 times a day, like not just quizzes, but pretty much you have to really, really study hard. One advice a lot of people give is to choose a medical school that has a pass or fail grading. That sort of eliminates, the competition. And whether you pass or not, and if you pass, then you just proceed to the next level. On your third and fourth year in medical school is when you start doing your, what we call, clerkship. And this is where clinical training comes in. Okay? So, obviously, whatever you have learned here, the theories you have learned here, you will now be applying in your clerkship training. But there's something you will need to do while you are in your third and your fourth year. So you have to start thinking of something we call USMLE, the United States Medical Licensing Examinations. And the United States Medical Licensing Examination has 3 steps: 1, 2, and 3. Step 1 is mostly basic knowledge and theory that you have learned in your first 2 years in medical school. So a lot of people would actually take step 1 after their second year in medical school. Step 2 is an exam for clinical skills. So usually you would take this around this time, just about when you're doing your clerkship training. Why do you need to take USMLE? Well, USMLE is a licensure exam, which means if you pass this, you will be licensed as a physician. Now, why am I only emphasizing the first two steps when I said there's actually 3 steps? We'll put that aside in a bit. After finishing medical school, after doing all of these, taking your USMLE, you will have to decide where you will take your residency training. And we said that this person wants to become an internist and specialize in internal medicine and eventually become a cancer doctor and oncologist. All right, so you would then want to apply to a residency program for internal medicine. During your 4th year, with all this going on, or hopefully you're done with that already and you have good scores for this, you will then scout out and look for residency programs for internal medicine. And you will have to put in a few choices, your first, your second, and third, maybe fourth, fifth choices. And there is a website that you go into where you apply and you put in your choices. The residency programs then looks into this website and they do this process called matching under the graduate medical, the American Graduate Medical body, the accrediting body for residency programs. And they will try to match you with your program based on your strengths, on your USMLE, all the other things they asked for as a requirement for application. And then you will get matched. Hopefully you get matched with your first choice. So this is kind of tricky because matching also depends on, they might like you a lot, but you only put them as your third choice. So they might not actually give much weight on your application. Matching is 1-to-1. So the ideal is this is your first choice for a residency program, and then they also like you, then they basically invite you to join their residency program. Okay, so let's just say you got matched into an internal medicine program. I'm going to proceed and subdivide this again because I'm just going to make it 3 because there are 3 years to our residency program. Let's put in the age in years. So what happens in the residency program? Well, residency programs start around July 1st. And, there's always a joke. Don't go to the emergency room, for instance, in July 1st, because that is the first day folks that have just graduated from medical school and they are still very much, in training, and they still need a lot of guidance. What happens in residency program? By the way, this residency program is usually done by what we call teaching hospitals. And what happens here is this. You will be called PGY1, Postgraduate Year 1, Postgraduate Year 2, Postgraduate Year 3. Why are you called a postgraduate? Well, remember, medical school is graduate school. You are actually now doing additional academic and clinical training postgraduate school, okay? In PGY1, you are undergoing an internship. Okay, internship. Let's actually write it down here to make it clearer. That's your first year of residency. After your internship, you need to actually qualify to proceed to PGY 2 and PGY 3. The program decides whether you are ready, otherwise, they will make you repeat. PGY 2 and PGY 3 is actually the formal residency. So you will now be called a resident, a second-year resident, a third-year resident. A first-year resident actually is an intern. Okay, so just to make clear, just to clarify all this terminologies over here. Remember this USMLE? Well, during the residency program, you're actually seeing patients, and therefore you are required a license, right? But only steps 1 and 2 are required for entrance or acceptance into a residency program. The third step, which is, so we said this is test of basic knowledge, this is test of your clinical skills. The third is actually diagnosis management. So it's a lot of practical exams here. This actually tests whether you can manage a diagnosis on your own. How do you take care of your patients? This will be required before you finish PGY 3. You will not be released from your residency program if you do not pass USMLE Step 3. There's another thing you need to be doing. Because you're in a residency of internal medicine, technically after your residency program, and you pass with flying colors the requirements of the program plus the USMLE 3, you are now a board eligible internist. Well, the best thing you can do is actually take your board exams, which is given by the American Board of Internal Medicine, ABIM. And if you pass this, you become board certified in internal medicine. This is a very arduous test. It takes a few days because it tests you into all the aspects of the residency program and all the organ systems, all the specialties that are under, subspecialties under internal medicine. So now you're done with your residency program. Remember we said this person wants to become a cancer doctor. So that person, they are not done. They are going through the same process of scouting out programs, and at this point in time, the person would want to get into a fellowship program. To divide that into three, and let's put the years 12, 13, and 14. Age in years 29, 30, 31. By the way, before we proceed to the fellowship program, after finishing your residency in internal medicine, you can now, and after passing ABIM and step 3, you are now an internist or a specialist in internal medicine, but you practice general medicine. That means you are a generalist, also known as primary care. So how long does it take to become a practicing professional physician in the US and become a general practitioner? Let's count. 1, 2, 3, 4. That includes bachelor's. 5, 6, 7, 8, medical school. 9, 10, 11. That includes residency program. So total, you need at least 11 years, or it takes about 11 years to become a primary care physician, general practitioner in the US. Okay, but you don't want to stop there because you want to be a cancer doctor. So you then apply to fellowship program. This is now called a fellowship. Program. Again, this is being offered by teaching hospitals that offer fellowship training in hematology oncology. So you got admitted into the program. You now become a fellow. First year fellow, second year fellow, third year fellow. And after 3 years, you're done. There's something else you need to do. You have to take the board exam given by ABIM for HemOnc. Board exam. How many board exams do you have to take? Well, you chose this specialty and there's actually 2 areas to it. That means you have to take 2 board exams, one for hematology and one for oncology. So after this, once you finish your board exam, you are triple boarded. You are boarded in hematology, you are boarded in oncology, you are also boarded in internal medicine. Can you still practice primary care? Sure. Of course you can. You could be a cancer doctor, but also do primary care. But very few people do that because the reason why they actually went through here is because they want to become subspecialists. Now let's go back to the question about the foreign medical graduates. Where do foreign medical graduates come into the picture? Foreign medical graduates are those physicians in training that want to get into a residency program, but graduated from a medical school outside of the United States. There are some exceptions. There are programs that are outside of the US. There's one in Israel, for instance, that are considered not, the graduates are not considered FMGs or foreign medical graduates. So basically, foreign medical graduates enter the picture here. This is where the FMGs come in to the picture. They basically need to pass this to apply to a residency program in the United States. Well, some of them will still be in their home country and they will have to say go to another country to take these exams. But the same thing is, the process is the same. They get accepted, they start the residency program. If they're not US citizens, they need what we call a J1 visa. We've discussed that previously. A lot of them stay on in the US after getting a visa waiver program, but they have to serve in what you call MUAs, medically underserved areas. And that's it. This is our timeline in terms of training to become a licensed practicing physician in the US. This covers practicing as a generalist, primary care, and this covers fellowship to become a subspecialist. And the example we use is hematology oncology.